The Upper Quadrant Y-Balance Test is a quick and reliable way of measuring somebody's upper body dynamic balance. There are three reach directions when we're performing the Upper Quadrant Y-Balance Test, and these are dependent upon which hand we've placed down and which arm we're testing. So if we're testing the left arm, the left hand is placed with the thumb against the red line. The medial direction is to the right, superolateral is upwards and to the left, and inferolateral direction is downwards and to the left. If we're testing the right hand, then the medial direction is to the left, the superolateral direction is upwards and to the right, and the inferolateral direction is backwards and to the right. Prior to performing the Upper Quadrant Y-Balance Test, we need to measure the limb length. So to do so, we take all measurements from the right-hand side of the body, the participants in standing, and we measure from the C7 to the distal tip of the longest finger. Errors to be avoided with the Upper Quadrant Y-Balance Test are placing the hand down, not controlling the marker placement, or placing the hand on the top of the marker rather than pushing against the red line. The Upper Quadrant Y-Balance Test is performed with 6 practice trials before there are 3 recorded trials. The subject assumes the press-up position with the testing hand with the thumb against the red line and feet shoulder width apart. They then push the marker as far as possible in the medial, the anterolateral and the posterolateral reach directions, and each distance is then recorded by the examiner. This protocol is then repeated another 2 times, with each distance being recorded by the examiner. The participant may bend their elbow during the test, which will enable them to reach further. The scorer needs to record each individual reach distance on a chart similar to the one shown in this image. You then need to take the best of each of the reach directions for your final analysis. The composite percentage reach distance can be calculated for each of your participants by setting up a good spreadsheet. So I'm going to show you the easiest way to do this. So we're going to put in the participant's name, and we're going to remember to keep confidentiality if needed. We'll then enter the best medial reach direction out of the 3, the best superolateral reach distance out of the 3, and the best inferolateral reach distance out of the 3. We can see here our calculation for the composite score, or the percentage reach, is the medial plus the superolateral plus the superomedial reach directions divided by 3 times their limb length and times it by 100 to give us our percentage. So in the total box here, I'm going to add up the 3 reach directions. I've entered the limb length already in this, so measured from the C7 to the distal tip of the longest finger, and I can now ask it to calculate the composite score. So we know that it's the total of the 3 reach distances, so it's going to be cell E2. We then need to divide it by 3 times the limb length. And to give us our percentage, we're going to times it by 100. Now this shows us that this participant here was able to reach 79.4% of their limb length. Now to make life easier for ourselves, we can simply use the little black box here. We can drag it down the column, and we can do the same when it comes to the composite score, and this will copy the formula across. And it means that if we get another participant in, we can just enter their details, and it will automatically calculate the composite score here for us.